Hello, Dr. Sandeep. My cousin has breast cancer. Can you please explain how to avoid hand swelling after breast cancer surgery?
Every person who undergoes breast cancer surgery is worried about this one complication, that is the swelling of the hand. And the concern is really true because once that swelling sets in, it is very difficult to get it away. In fact, if you had seen some patients who had undergone mastectomy or breast cancer surgery in the previous, say about 20 years back or so, you would have seen them with huge arms which are very difficult to manage, something like elephantiasis. But things have changed. We know much more about the condition today and we are able to handle it much better. Now, what are the types of lymphedema that we see after breast cancer surgery? So there are three distinct lymphedema types which we see. One is the lymphedema that happens immediately after surgery, which actually resolves within few days. There is just a post-surgical edema. It is a swelling that happens because of surgery itself and that resolves within few days. The second group is the one which occurs within a few days, say about 4 to 6 weeks after surgery or radiation. These are typically the edema or the swelling which resolve with physiotherapy. They are also very much resolvable or we can get rid of them. The third category of edema is the one which happens after a longer duration of time, say 6 months or even after 24 months, that is 2 years of surgery and treatment. These swellings are very dangerous. They don't reverse back. So these are the ones which have to be careful about and avoid as much as possible. So can lymphedema be prevented? There are two aspects to this question. One, can it be prevented by any way by surgery, which we have already answered? The answer is sentinel node biopsy, which we have discussed earlier. Once the surgery is over, can a patient take care of themselves to prevent any form of edema from occurring? Yes, there are a list of things which we will be providing as we go on. But let me also tell you what are the symptoms of lymphedema. Symptoms are that you feel very heavy in the arm, you feel some kind of an itching in the arm, you see some kind of redness around the arm. So these are the key symptoms which you have to watch for. So whenever these symptoms occur, you should always approach your medical healthcare professional. In addition to this, what is very important is, and which is advised to every breast cancer patient who undergoes surgery, is to not wear any bangles on the side of surgery, especially the glass ones which can break and injure. Avoid all the rings because rings can constrict and increase the edema. So it becomes very difficult to remove it and there can be a catastrophic event after that. Avoid any wounds, and whenever there is a wound, even for example if there is some nail injury or any of those things, take medical help immediately. The wound should not get infected because any infection can lead to an edema. So there are many of these aspects which a person who undergoes surgery should be very careful about. Another important thing is giving any injections, taking any blood from the same side. All these things are some of the reasons for which a patient can get into trouble or get into edema, or edema can start because of that. So all that has to be avoided. A careful avoiding of any form of injury is very important as far as prevention of edema is concerned. On the other side, very important thing to remember is the exercises. You have to follow all the exercises which have been advised, and whenever there is a swelling, while sleeping, elevate the arm, keep it up on a pillow so that the swelling comes down in the night. Because what happens is you should not allow it to stay over there and solidify, because when it solidifies, it does not go. So drain it every day by keeping the arm up. So over next few days, it may come down and resolve by itself. So only thing when we are concerned, as I told you earlier, is when the edema that starts after a year or two of surgery, in which case the edema does not resolve easily, and these are rare cases in today's scenario. In these cases, we do offer some surgeries like a lymph node transplant or a omental transplant. There are some surgeries which we can perform, but again, the success rate of these surgeries is low. So always prevention is better than cure in the case of lymphedema. In addition to this, also very important to remember is your diet, because when you gain weight, even the edema increases. So it is always better to keep yourself healthy by exercise, controlling your diet, so avoiding any weight gain. So that also prevents an edema, and healthy lifestyle will take you a long way.